Now, let's face it, dental implants are not for everybody. We have a concept, it's called Pick-a-Path. And the concept started 20 years ago. It's our responsibility to help you decide which path makes the most sense. For example, if your teeth are going to be here 10 or 20 years from now, and they're going to be healthy and they're going to be dependable, the path that you're going to want to choose is to keep your teeth into, we say, double down on making sure your natural teeth are going to satisfy your goals. If your natural teeth are not going to be around 10, 20 years from now, but you are, then typically what we do is we think that the dental implant path is more predictable, it's easier, it's certainly more cost effective than trying to work around whatever you have left from a natural tooth situation. And so oftentimes this decision of deciding, do you go right or do you go left? Do you keep your teeth or do you replace your teeth? That's probably one of the most important health decisions you're going to have the ability to make yourself. And our job with Pick-a-Path is that as your clinical consultants, the doctors and the team at Hybridge, our job is to do a deep dive and really analyze the condition of your natural teeth, help you determine how good are those teeth, and then help you make a decision that someday you're not going to regret. And the problem with historical dentistry is that people do dentistry only to find out that 10 or 15 years later, they wish they hadn't picked that path. And so what's different about Hybridge? We're here to educate you. We're here to help you make a very difficult decision, one in which satisfies all of your objectives, and also what is the least amount of dentistry that you can do that can satisfy what your goals are long term. And if we can do that for you and do it at the most cost-effective way, then Hybridge is ultimately the right path for you at this time. So my suggestion would be is if you're at that point where you're confused, you don't have clarity, you've heard differing opinions on maybe what you should be doing, just take a pause. Let us help get some clarity around what your dental situation is, and then make the decision that you need. I think oftentimes, if you're unsure, just take that pause and learn more about what we can do for you.